Welcome. My name is Stefan Neff. I'm a consultant anaesthetist, and I will have the honor and pleasure of making you nice and comfortable during your upcoming surgery. I work with a number of surgeons, all of whom have their own intricacies, and depending upon the surgery that you are undergoing, there are certain things that we need to talk about. This little video is meant to be seen after you have already seen the excellent video from the New Zealand Society of Anaesthetists. In this video, the society has put together a beautiful walkthrough through the step-by-step process of having surgery and all the things that in general terms you need to know. So please stop the recording if you haven't watched it yet and watch that one first. Every surgeon and every anaesthetist is a little bit different, and therefore the art of anesthesia is really all about trying to match what I believe is the best and safest anesthetic to you and your needs. That also includes particular consideration for the surgery being performed. For example, when it comes to shoulder surgery, many surgeons do not want the patient to be on anti-inflammatories such as ibuprofen or diclofenac. The reason is that these medications can sometimes make it just a little bit more likely to bleed. And after the surgery, if you were to continue using them on a regular basis, there's maybe a small suggestion that your shoulder tendons won't heal the way you and your surgeon would like. Therefore, if you know that you're undergoing shoulder surgery and if you know that really you're relying on anti-inflammatories, then please contact your surgeon so that long before the operation is happening, that you can be switched over to other medications or a plan can be made. When it comes to food, I do not want you to eat anything from midnight onwards. That often has to do with the current craziness in the world because we don't really know the exact time that you will undergo your surgery. Even if we have at the moment 3-4 cases booked, and in theory we could predict roughly, okay, you should be then and there. With COVID and with other challenges to our society, things become more uncertain. And it would be much easier for us to plan the day of surgery if we know that you haven't had a big breakfast and therefore can be brought forward to the appropriate timing on the day. Water, however, is of absolute importance. We all are dehydrated. We all run around like dried crisps. And that starts really from the age 30 about there onwards when we start losing our thirst. And therefore, it is so good to actually rehydrate yourself in the days leading up to surgery, especially if you undergo bowel surgery where maybe you get specific medications that empty your bowel, with which you actually then lose more fluid. So in general terms, I want you to drink heaps of water on the day of surgery up till 2 hours prior to your surgery. Or if you're living here in Rotorua, make it 1 hour before you come for the admission. If you're living a bit further away and you know you need to travel an hour to get here, make it easy. Have another glass of water just before you leave home. Then with that, you're nicely rehydrated, and it will be so much easier to put a little needle in the back of your hand so that we can then give you medications to make you nice and comfortable. When I talk about rehydration, I also include maybe black coffee or black tea or green tea for that matter. Nothing with milk. And that is so important. Milk is healthy, yes, fair call, but not on the day of surgery because it will completely change what happens in your stomach. So if you by accident have a coffee with some milk in there, we will not be able to do you for 6 hours. And it is potential that we actually have to cancel your surgery on the day. So please, no milk, no anything else than water, black coffee, and black tea. Many people nowadays take vitamins and nutraceuticals, many of which are actually really, really good and very sensible in your general life. And I commend you for looking after your health from that point of view. However, when it comes to anesthesia, we need to figure out, are you taking anything that potentially can put you at a higher risk. And as such, many hospitals are doing a blanket rule and say, no, no nutraceuticals, nothing healthy, stop everything for 2 weeks. That's probably not so clever, but it's a pragmatic approach with which hospitals manage the risk. Personally, if you're not taking a multivitamin, then I advise you take a multivitamin. Go to the pharmacy and get yourself a nice broad spectrum vitamin with lots of good stuff in there that you need for your body to heal itself. After all, you will go through quite a traumatic time, i.e. the surgeon is cutting into you. So your body needs to repair itself. And if the shelves are half bare when the cells are trying to put everything back together, well, you're not healing so well. So multivitamin within all means. But we want to rule out those things that potentially can cause more bleeding, especially when it comes to shoulder surgery or spine surgery. These include the 4Gs, garlic, ginger, ginkgo, ginseng, as well as the omega-3 fatty acids, which are designed to make your blood flow more smooth through the body. And it's very good in longer term, but certainly not on the days leading up to surgery. So if you can please stop those things for at least a week prior to surgery, that would probably be in your best interest. If there are any concerns, either ask me or ask your surgeon well ahead of time. In the other video, you have already learned about the need to alter certain medications, for example, for diabetes or as blood thinners. Another group of drugs that we look out for are some of the blood pressure lowering medications. Regrettably, when patients who are on such medications, when they undergo general anesthetic, sometimes their blood pressure can really go quite low, too low for our taste. So therefore, if you are on any ACE inhibitors, and they typically end with the name PRIL, captopril, enalapril, lisinopril, any pril, we probably don't want to have on the day of surgery. The same is with the artans, candesartan, losartan, anything that's artan is probably not right. So that's the important time when we actually sort of need to talk before the operation. What can you take? What can't you take? So if you are up to date with your medications and have told us in your anesthetic questionnaire all the drugs that you are taking, we have got the best baseline from which to work, and make sure that you're not taking something that potentially inadvertently can harm you. You have already heard how important it is for 24 hours not to use heavy machinery or drive a car. That all makes sense. Because yes, the anesthetic in its own right can cause maybe lingering malfunction up there, where you are either not really concentrated enough, or where maybe your mood changes. It's not so uncommon that patients are very euphoric and yay, it's done. And finally, the pain is under control. After all, many people come here for pain. So therefore, you wouldn't be the first one who's really, really, really in a good mood. Please don't buy a Porsche on Trade Me and then blame me for it. So when it says don't do any big life-altering decisions, that also includes emails and maybe Facebook and maybe any kind of social messaging. So take it easy there. This is time for you to relax. This is time for you to read or sleep. Many a times, patient says, why am I so sleepy after surgery? Well, you haven't slept for 6 months because your shoulder was hurting you and you couldn't lie on the side. Every night you were awake 6 times. And now you're asking, well, why are you a bit sleepy when I finally take care of the pain? You know, there are more reasons. The classic one is the young mums who have been looking 24/7 after their children. And then finally they come to us, they have a general anesthetic, and you need a kettle brought to wake them up. And it is what it is. So give yourself the time to heal, give yourself the time to relax after the surgery. If you have any other questions, then please raise them with me during the telephone call or during our face-to-face meeting. one way or the other. I want you to know that you're in good hands, that I only work with surgeons and whom I completely trust, whom I would go under the knife with, so to speak. I would be very happy to be any of my surgeons to operate on me. And that says a lot when the anaesthetist this much approves of the surgeon. So I love the way that I work in the teams that I work in. And yes, be my guest, come along for a ride. Yes, it's scary. And yes, you can be a bit anxious and your blood pressure can be a bit high when you come to us. If you can't be anxious, then when can you in life? These are normal emotions. These are normal reactions. Don't be scared of them. Just experience them and understand that this is your fight and flight system jumping in and saying, look, it's really not good to be cut. And you have to say, yes, you're right. Thank you, dear fight and flight system. It's not so clever to be cut, but I need to be cut to get better. So maybe look at it from that angle. All those emotions are normal. Until your surgery, I'm wishing you a safe time. Please, please, please look after yourself. With that, I also mean your skin, because many patients are tempted to go out there and prune the roses and do the hedges and split the firewood, all the kind of things that they want to get out of the way. And then some patients come to us, and unfortunately, they have got a big scratch, and that scratch looks a bit pussy. Well, it's very unlikely that we can do your surgery because, if you put a new knee joint in there, those bugs here, they can go onto the knee joint. That's not clever. That is a catastrophe. So therefore, please, if you do any kind of work in the shed or in the garden, if you really have to, then cover up, put gloves on, put definitely sturdy gloves on so that any kind of bramble or whatever doesn't really hurt you and impair your chances of having successful surgery.